Hello, my name is Nikki. I'm going to be doing the NG tube insertion for BSN 246. I will make sure that I have MD orders to insert the NG tube and see what patient I'm going to be inserting the tube for. Once I have that information, I'm going to go ahead and gather my supplies. I'm going to need an NG tube, a safety pin, lubricating jelly, a chuck pad, gloves, a syringe, a pen light, water for the resident, a basin. I have pre-cut tape, and I will also need pH strips and suction, which I don't have on hand. Once I have all my supplies gathered, I'm going to go ahead and enter the patient's room. Knock, knock. Can I come in? Patient says yes. I'll close the door behind me. I'll do my hand hygiene and put on my gloves. Before we start, can you tell me your name and date of birth? John Smith, September 17th, 1996. It matches his ID band, matches the patient I will be doing this procedure for. Today, we will be placing an NG tube for you. Doctor has ordered this to help get rid of some of that gastric contents that's causing you some discomfort. I am going to go ahead and explain the procedure a little bit to the patient. So the NG tube is going to go into your nostrils and down your throat into your stomach, so we can suction out some of that gastric contents. I'll walk you through the process as we go, but when the NG tube goes down your throat, when you feel it in your throat, I will have you lean your head forward and take sips of water as I tell you to. Do you have any questions as of right now? The patient says no. I'm going to go ahead and sit them in high Fowler's position, and I'm going to have the patient hyperextend their neck. With my pen light, I'm going to look into both nostrils, looking for any deviations or any abnormalities. Both nostrils look good. No deviations, no abnormalities. Next, I'm going to close one of the nostrils and I'll have you breathe in and out. Go ahead and breathe in and out. And the other side, in and out. Both with good airflow, but we will be using the patient's left nostril. And I'm going to have my NG tube soak in some warm water, and I will be taking the patient's vitals, making sure that they're stable, and then I will be keeping the pulse ox on the patient during this procedure just to make sure they don't have any episodes of desaturation or anything like that. I am gonna ask the patient if they have any more questions. Do you have any more questions? Patient's okay. So we're gonna go ahead and start. We're gonna start by measuring the NG tube. So for the measurement, we're going to go from the tip of the nose to the earlobe and then down to the xiphoid process, which is about 35. So I'm going to take a piece of tape and tape that there so I know how deep I need to go with the NG tube. Now that that's taped, I'm going to put the chuck onto the patient and give them their cup of water. I'm going to have them hyperextend their head. If you feel any pain or discomfort as I'm going, please raise your hand and let me know. We will stop and give you a minute. I'm going to lubricate the tip of the NG tube for smoother insertion. And I'm going to start. Okay, here we go. I'm going to go in. I'm going to just follow the anatomy of the body, going with the curvature. Okay, now that we're at the throat, I'll have you take sips of water as I push it, the NG tube further. Sip, 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 and I am inserting this about 2 inches every time. Sip, sip, sip. The patient also leaned their head forward as they were taking sips of water. Now that we're at the tape, I'm going to go ahead and secure this to the patient, and then we will get x-ray here to confirm. While we wait for x-ray, I'm going to go ahead and take some of the gastric contents, about 5 to 10 cc's. I'll do 10 cc's, and then I'm going to put that into my basin, and we'll be checking the pH with the pH strips. The pH is at 4, which is good. We're aiming for anywhere from 3.5 to 5. That's our first placement. Second placement, the x-ray confirmed that the NG tube was in the right area. I'm going to hook the tube to the resident's gown, and then I'm going to take my chevron tape and really secure this to the patient, just to make sure that it doesn't move. I'm going to provide patient education. So while you have the NG tube in, I want you to try to refrain from tugging at the tube, and then we need to keep your head of the bed elevated at all times. So we need it at a 45-degree angle or more, because now that with the NG tube, you're at risk for aspiration, and we don't want any aspiration. I'm going to hook up the NG tube to suction, and I'll be checking that about every 2 hours. I'm going to clean up my area. I'm going to doff my gloves, perform hand hygiene, and then I will be documenting how the procedure was tolerated, and then I will also be documenting the amount of gastric contents that was removed, any characteristics such as color, consistency of the gastric contents, and wait for more MD orders.